Hi guys, welcome back to Habib Khawaja.The Explorer. So my today's topic is about slip disc, because as you know, so many of us are already suffering from uh, stabbing back pain due to slip disc, and but so many of us don't know exactly what they're supposed to do, what they're supposed to follow. So we start the first thing first, and that is that first of all you need to go to your doctor, you need to go to your GP and tell your GP about what you are going through with, and the doctor will definitely give you a nice advice what to do and how to deal with your back pain. But because I myself have been the victim of slip disc few years ago. I think somewhere around in year 2015, I was a victim of slip disc, and I've been through a very difficult time, guys. Trust me, it was so painful, and I kept facing stabbing back pain, and so much of my time got wasted just because I had no clue what went wrong and what I've been going through with exactly. I didn't know anything at all, guys. So what did I do? Uh, I went to my doctor. My doctor referred me to the physiotherapist. Physiotherapist gave me some appointments and gave me some physiotherapy sessions, and but nothing was getting fixed at all. And then I went back to my GP. I told him that this is what is happening at the moment, and my pain is not going anywhere at all. So what did he do? He referred me to the MRI scan. I requested him to send me to the MRI scan department so that I could be able to get my MRI scan done as soon as possible to find out the exact problem because of that, whatever is happening. And that was a time that I was so much down. My spirit was so much low at that time, at that point, and I was totally in a negative frame of mind, guys, because of my stabbing back pain, and I was unable to stand full like this, and I was like in a bending situation all the time, rather most of the times. And anyways, I went to the MRI department and I gone through with the MRI scan, and I got the MRI scan report, and I discussed that with my doctor and with the orthopedic surgeon. They gave me two options as far as slip disc treatment was concerned, but those two options were not a permanent solution at all, guys. I'm telling you. So what were those two options? Those two options were, first one was steroid injection. The steroid injection can send the pain into a sleep mode, but this is not a permanent solution at all. What will happen after getting the steroid injection in your back? The pain will go away, guys, for few months. But after few months, the pain will come back again. But just imagine what will happen during those 4 or 5 months time period when you were not feeling the pain. Problem is still there, but you were not feeling the pain. The reason is that you got the steroid injection and the pain fell asleep, went into a sleep mode. But the process of wear and tear was on during those 4 or 5 months time period, and the muscles and the discs in your lower back area, they kept doing what they were doing before you got the steroid injection. So the worn and torn will be going on. That process of wear and tear will be going on during those 4 to 5 months time period, guys. So it will become worse after 4 or 5 months time period when the pain will come back. So this is not a permanent solution at all, guys. This is a temporary solution. So the second option is a surgical procedure will be performed at your lower back. So what will be happen that the consequences of that surgical procedure can be so disastrous and could be a life-threatening one as well. Because when my orthopedic surgeon gave me the option for the surgical procedure, then I asked him, what are the chances that it will get reversed? My slip disc problem could be able to get reversed. So he replied, he said, nothing will be reversed. And there are chances that you will be paralyzed. This can be one of the consequences of the surgical procedures, that the lower part of my body can go into a paralysis, can be paralyzed for forever. So I thought these two options are not the suitable ones at all for this particular cause. So then what did I do? I went on to reading the remarks and the reviews of those people who went through with the surgical procedure, and but their problem were never fixed at all. And some of them, they lost their lower part of their body. They got their lower part of body paralyzed forever. And that was so disastrous. So I became scared of that. And I refused to go for these two options. One was steroid injection, the other was surgical procedure. So what did I do, guys? One of my relatives, my brother-in-law actually, he referred me to a person who knew how to fix the slip disc issue, how to deal with that. Anyways, so I'm gonna show you the exercise in a minute. And my request to you guys, is don't go for a steroid injection, and also don't go for a surgical procedure at all. Only follow the exercise I'm going to show you in a minute. If you have become the victim of slip disc, then follow that exercise, and by the grace of Almighty God Allah, you will get cured, inshallah. Right? So here we go. Stay with me, guys. So one more thing, my advice to you is, if any of you is a victim of slip disc, then try to avoid doing push-ups at all, because when you will be doing push-ups after getting slip disc, then what will happen, that your whole body weight will gather in your lower back area and will force your discs to get slipped again, right? So guys, don't do push-ups at all. I'll tell you how you can do push-ups. I'll show you the way of doing push-ups, but in a very careful manners, right? You have to do it very carefully, guys. Okay? Here we go.
Hi guys, welcome back. So I wanted to let you know about one thing which is so important to tell you. That is that once you got slip disc, then please don't go for a surgical procedure at all. Or don't go for steroid injection as well, because these two options are temporary options, right? It's not a permanent solution at all, okay? And once, if any of you got surgical procedure performed on your back, then try not to follow the exercise I'm going to show you now in a minute, okay? Right. Stay blessed.
So here we go. Right, guys, so I'm gonna show you the exercise now, right? Are you ready, guys? Okay, so here we go. Yes, guys, so please watch this exercise carefully, and I'm gonna do it now, and you can perform this exercise at home, right? And I'll also show you how to do push-ups. Being a slip disc patient, you could do this at home or at anywhere, but don't do the conventional type of push-ups, right? Avoid that. Avoid doing that. That could hurt your back or could slip the disc again, right? Okay, so here we go. So first of all, what you need to do is you need to lie down on the ground, okay? Here. So, and then you need to take a right turn, guys. This particular exercise is only for the slip disc patients, right? And those patients who have never ever gone through a surgical procedure on their back, okay? Right. So you need to take a right turn and hold your knee from one hand. If you are alone, you can do this at home by holding your knee from your right hand, and you need to turn the upper part of your body on the left side, like I'm going to do it now. Slowly, slowly. And then come back to the normal position again. And repeat it again, like I'm doing now. Breathe in, breathe out, guys. Remember, always. and repeat it again third time. And when you will be doing this, you could hear a sound like a crack here, in this area, or in this area, right guys? So it means you are doing the alignment of your lower back. Right. So in the same way, you have to do it on the left side as well. Like I'm doing now. And one more time. You could hear the noise, you could hear the sound like crack here or here. And repeat it for the third time. Right. So all done guys, and I hope this is a useful video for the people who are suffering from slip disc, and will definitely help them to deal with their stabbing back pain, and will resolve the issue immediately, in less than 5 minutes guys. Yes. So right, so I'm gonna say something in Urdu language as well for my Urdu speaking viewers, and because obviously I want to cover the maximum circle of my viewership, right? So guys, the thing is, first of all, assalamu alaikum to everyone, and secondly, आपने ये वीडियो देखी है जी मेरी, और आई होप कि इससे बड़ा आपको फ़ायदा होगा। पहले तो मैं आपको ये कहता चलूँ, अस्सलाम वालेकुम टू माय उर्दू स्पीकिंग व्यूअर्स। देखिए, मैं ये कहना चाहता हूँ कि जो लोग भी स्लिप डिस्क के पेशेंट्स हैं, उनको चाहिए कि जो एक्सरसाइज मैंने अभी करके दिखाई है, इस एक्सरसाइज को फॉलो करें। लेकिन ये एक्सरसाइज सिर्फ उन लोगों के लिए है जिन लोगों ने लोअर बैक का ऑपरेशन नहीं करवाया, कोई सर्जरी नहीं करवाई अभी तक, राइट? जिन लोगों ने अपनी डिस्क की सर्जरी करवा चुके हैं, उन लोगों के लिए ये एक्सरसाइज नहीं है। वो लोग अगर ये वाली एक्सरसाइज करेंगे तो उनके लिए वर्स्ट हो सकती है सूरत हाल, जो है सिचुएशन उनके लिए वर्स्ट हो सकती है, और उनको कोई फ़ायदा नहीं हो सकता इस चीज़ का। आई डोंट थिंक सो कि उनको कोई फ़ायदा होगा, बिकॉज ऑलरेडी उन्होंने सर्जरी तो करवा ली है। अब सर्जरी करवा चुकने के बाद जो है उसके जो नताइज होते हैं, कॉन्सिक्वेंसेस होते हैं, वो कोई अच्छे नहीं हैं लोगों को, कोई लोगों को अच्छा एक्सपीरियंस नहीं हुआ, ठीक है। और मैंने सारे रिव्यूज़ पढ़े हैं उन लोगों के जिन्होंने सर्जरी करवाई है। किसी का जो लोअर बैक है, लोअर पार्ट ऑफ बॉडी, नीचे वाला जो हिस्सा है, ठीक है, बॉडी का, वो मफलूज हो गया, पैरालाइज हो गया, ठीक है जी। तो बेहतर है कि पहले तो सर्जरी ना करवाई जाए। दूसरा, अगर आपने सर्जरी नहीं करवाई और स्टेरॉइड इंजेक्शन लगवा लिया है, तो सिर्फ स्टेरॉइड इंजेक्शन लगवाया है, तो तब भी आप ये एक्सरसाइज फॉलो कर सकते हैं, बिकॉज आपने सर्जिकल प्रोसीजर तो करवाया नहीं है, ठीक है। तो आप ये जो मैंने अभी एक्सरसाइज आपको दिखाई है, ये ख़ास तौर पे उन लोगों के लिए है जिनकी जो लोअर बैक में जो डिस्क है L4 L5 वो स्लिप हुई है, ये उनके लिए, ठीक है। तो बराए मेहरबानी जिन्होंने अपनी सर्जरी करवा ली है वो ये परफॉर्म ना करें, क्योंकि मेरी जिम्मेदारी नहीं है वो, ठीक है। अगर कोई करता है और अगर वर्स्ट हो जाती है उसकी फिजिकल कंडीशन या उसकी जो पेन है वो बढ़ जाती है, उन लोगों की जिन्होंने सर्जरी करवाई हुई है अपनी बैक पे, तो आई एम अफ्रेड कि वो अगर उनको कोई फ़ायदा नहीं होता तो इट विल नॉट बी माई रिस्पॉन्सिबिलिटी, राइट। मेरी जिम्मेदारी नहीं होगी वो। मैंने जो आपको बताया है वो उनके लिए है जिनकी अभी रिसेंटली या रिसेंट पास्ट में उनकी डिस्क स्लिप हुई थी और सिर्फ डिस्क स्लिप हुई है और उन्होंने अभी तक कोई इसको सर्जिकल प्रोसीजर नहीं किया अभी अपनी बैक पे, लोअर बैक में L4 L5 जो डिस्क का एरिया है वहाँ पे अभी कोई उन्होंने सर्जरी नहीं करवाई, राइट। ये चीज़ होगी। सेकेंडली मैंने आपको भी बताना है, राइट, आई एम गोना टेल यू गाइज समथिंग अबाउट पुशअप्स, हाउ कैन you perform push-ups at home or at anywhere or in the gym, right? The push-ups I'm going to do, I'm going to show you, is for those people with the slip disc, right? So normally when we do push-ups at home or in the gym, then how do we do the push-ups? I'm going to show you now. We do the push-ups like this. This is we do in our usual routine, right? But for the slip disc patients, don't do the traditional style push-ups, right? It can hurt your back or you might get your disc slipped again, okay? So I'm going to show you how can you do push-ups at home or in the gym. You're in the gym, right? So, and this will not hurt your back. Here we go. Always remember, breathe in, breathe out. Right, guys.